Thank you for subscribing to this channel. This is a Reading Part C practice video.
Option A is correct according to the paragraph because it specifically mentions that a member of the team, ideally the nurse caring for the patient in cardiac arrest, be designated for that role and remain with the family during the whole process, and explain everything that is happening. This implies that the designated team member should provide constant reassurance to the family members. Option B is incorrect as the paragraph does not mention that the team member will find the experience as stressful as family members. Option C is incorrect as the paragraph suggests that health professionals should explain everything that is happening, which includes providing information to the family members. Option D is also incorrect as the paragraph suggests that a designated team member should explain everything to the family members, rather than each individual family member separately.
Let's look at the next question.
Option C is correct according to the paragraph, as it specifically mentions that the nurse should inform the resuscitation team leader when the relatives should enter the resuscitation area, and that the team retains the option to request that the family be escorted away from the bedside and/or out of the room if deemed appropriate. This implies that the point at which family members enter or leave the scene is important during resuscitation. Option A is incorrect, as the paragraph does not suggest that establishing that the resuscitation team are in charge is the most important aspect during resuscitation. Option B is incorrect, as the paragraph does mention the importance of discussing the wishes of the patient and/or relatives as soon as possible to act in their best interests, but it does not suggest that this is the most important aspect during resuscitation. Option D is also incorrect, as the paragraph does not mention the importance of remaining courteous when requesting relatives to leave. However, it does suggest that the team should be non-judgmental and supportive of the relatives' decisions, regardless of whether they choose to be present or not.
Let's look at the next question.
Option B is correct according to the paragraph. Judith Goldman suggests that families who wish to be present may struggle to understand why they cannot enter at certain times. She mentions that the nurse should inform the resuscitation team leader and seek their approval before allowing the family to enter the resuscitation area, and the team retains the option to request that the family be escorted away from the bedside and/or out of the room if deemed appropriate. Such decisions are not taken lightly, and the team needs to consider times when all members of staff are fully occupied and there is no one available to stay with the family. This can be especially hard for them to take. Option A is incorrect because the paragraph does not mention anything about extra staff not being available. Option C is incorrect because the paragraph does not suggest that families prefer to remain with the allocated member of staff. Option D is also incorrect because the paragraph does not discuss families' concerns about witnessing the resuscitation. Option D is correct because the paragraph states that providing assistance is crucial for families to get through such a stressful and shocking event, and that professional bereavement counseling outside of the hospital can help with symptoms of post-traumatic stress disorder. This suggests that families are likely to struggle to overcome the experience. Option A is incorrect because the paragraph suggests that families should be pointed towards professional bereavement counseling, but it does not say that they are required to seek it. Option B is incorrect because while the paragraph suggests that families should be pointed towards all available support services within the hospital, it also suggests that professional bereavement counseling outside of the hospital may be beneficial. Option C is incorrect because the paragraph does not mention anything about families regretting their decision to remain present.